to switch tracks here and talk to our good friend Justin Brock from Acacia Apothecary and Wellness. And if you want to learn more about them, it's Acacia, ACACIARX.com. They're an amazing compounding pharmacy here in Tucson and now are reaching out and doing work all over the state and the country. And Justin, welcome to the show again, and thanks for taking some time this morning.
It's great to be here. Thank you.
Yeah. Tell everybody what a PCABE accredited pharmacy is, because I think people need to know the what you have to go through.
Right. So what PCABE is kind of an independent audit of our pharmacy. It's optional. Compounding pharmacies don't have to get this accreditation. I think the number is around 10% of compounding pharmacies in Arizona have this accreditation, and basically we go through steps with our procedures, with quality, with safety, and that's not just for the products that we produce, it's also for our staff, because the medicine is not for them. So we don't want them to inhale it or to absorb it through their skin. So there's all these steps that we go through, and PCAB comes in and audits our processes over a few days and our documentation, et cetera, and just gives us the seal of approval. And the great thing about this is that it helps you as a consumer. When you're making a decision about which compounding pharmacy to use, it helps you to kind of decide, okay,
Yes.
This company has come in and give them the stamp that says that that everything that they do is at the utmost quality. As an example, one of the things that we do is we send out our compounds that we make, a certain number of lots every month, to a lab to kind of audit to make sure that we're doing it appropriately. That
Sure.
it is, if this is a methimazole 5 milligrams per 0.1 milliliters, that it is 5 milligrams for 0.1 mLs.
Right, right. And I want to read this off of their website. The goal of prescription compounding is to achieve the best possible outcomes for patients by working closely with our patients, their physicians, veterinarians, to customize their medication and medication delivery. And so, and it really is a godsend for someone like myself, because we deal with such a variety. We have the 3-pound Chihuahua, and we have the 175-pound Great Dane.
Right.
And, when there are, a medication that comes out in a 250 milligram or a 500 milligram capsule, and that's the only choices you've
Right.
got, it makes it very, very difficult to appropriately medicate them.
Right.
Plus the fact, from personal experience and working with Justin, I mean, even, one of the drugs that we use a lot of and we should talk about is methimazole, which I always have a hard time saying.
Who doesn't?
And this is for hyperthyroidism in mostly our cats that we deal with. And so if anybody, all of our listeners that have cats can chime in on this, but you have a cat and you have to give medication, the two don't usually meet very well.
Right. Cats are cats.
Cats are cats. So methimazole comes in a tablet.
Mm-hmm.
It can be made into a liquid.
Right.
It can be made into a transdermal gel.
Right.
Any other options on that?
That's probably 98% of what we do. Right,
So,
for methimazole.
so here I have a cat that someone wants to try the tablet, and of course they call me back the next day or two and say that isn't going to work.
Mm-hmm.
And they have a hard time getting even a flavored liquid. But we have a transdermal gel that we can use that you guys can work up. And it really requires putting a finger cot on, a finger protection, and putting this gel inside your cat's ear twice a day. What a godsend.
Right. Yeah, I think that's a great and that delivery obviously would be ideal for cats whenever possible, just again because cats are cats. But
Yeah.
not all molecules, not all drugs are able to be absorbed effectively that way. But cats' ears are unique in that they have this physiology, this highly vascularized area. It's hairless for the most part,
Sure.
so it works really well for this purpose. The methimazole, it is a small amount that they apply. They rub into the inside of the ear, and we put it in a pin. One of the problems for years when we were making this up, we would put it in syringes. And the syringes are just, we're talking about 0.1 milliliters, so it's a very small amount. So for some of our pet owners, it was hard for them to give that proper dose. Now we have a pin that's metered, so it gives exactly 0.1 milliliters, and it's got a flexible tip so they can kind of hold it up against the ear. They can almost use the flexible tip of the pin to apply it and rub it in, so they don't even necessarily always even have to put on the gloves on their or finger cots on their finger to rub it in. That's ideal, but the the pen is a good way to do that now. We're glad that we switched to that, and a lot of our pet owners appreciate it.
And here's a perfect situation where, again, Justin's just taking a delivery system like a syringe and even improving on it to make it really much more exacting for our animals and our clients by using a pen. That's a great story, and it's an amazing benefit. We have a lot of animals in the Southwest, and they have the similar type diseases in the Midwest and the East, which are basically our fungal diseases. Mm-hmm. Here it's coccidiomycosis or valley fever. And one of the big problems that we all ran into not all that long ago was there were like 10 companies making the medication fluconazole that we used often for the treatment, which was, I think, the third generation of those azoles. First it was ketoconazole, then itraconazole, then fluconazole, I think. I'm not sure if that's accurate, but at least that's what happened in veterinary medicine.
Okay.
And then all of a sudden, like 9 out of the 10 companies making that drug dropped out.
Right.
Do you know the reason for why that happened?
Well, I think, without getting too far into it, but I think the real reason for it was that valley fever is a very big problem, obviously, in Arizona and in the Southwest and New Mexico, Nevada, et cetera. But it doesn't move the needle when you're talking about a drug manufacturer nationally or globally.
Sure.
Let's say it affects, I don't know what the number is, let's say it affects, 50,000 or 100,000 dogs in Arizona. That seems like a lot for us, but if you're a drug company and you have, all of the costs that go into making a drug and you can focus your efforts on this drug or that drug, $100,000 doesn't really move it. And so and you would say, well, now it's really expensive, so you think more drug companies would enter that market. But once they do, then it brings the price down. So the more people, the more manufacturers that enter the market, it brings the cost down. So I think that's probably what drives the cost up. At least that's what I've read about. And then again, going back to what you said before about, you have a 25 or 5 pound Chihuahua and a 145 pound Great Dane. Just last night, we got a prescription called in for a Mastiff, 143 pounds, needed 636 milligrams of fluconazole, and they didn't have an option. The option of the commercial medication would have begun to give 2 or 3 1/4 tablets.
That was my dog, by the way.
Yeah,
I think we called it in.
Yeah, no, it was. It was one of your. It was one of your pet
owners.
owners.
Not my personal dog, but one of our owners.
Right.
Yeah.
Yep,
So
absolutely was. It was your prescription last night.
What would that have cost if I had gone to fill that prescription at like a regular pharmacy? If you have to give 3 1/4.
3 1/4 for a month's supply, I'd imagine you're probably looking at, and again, the different pharmacies, there's different prices, but I would say probably going around $400 or $500 for a month's supply.
And can I ask you, just because for comparison's sake,
Yeah.
I don't want to put you on the spot, but what we do with Justin is, because we treat our animals in 3-month blocks, and he's kind enough to make us 3 months of that medication. Was it even that price for that dog?
They could have gotten a 3-month supply for the same amount for the cost that they would have paid at a regular. I'm sorry, half of what they would have paid at a regular pharmacy. They could get a 3-month supply for us.
Right.
So they ended up getting a 1-month supply, and it was through us. It was probably a fourth or a fifth of the cost. But again, the other important part is it's a customized, and they're getting the capsule that's exactly the right strength. So they don't need a quarter and then running into tablets crumbling on them and et cetera. So it makes it much easier to dose the animal and to improve adherence, et cetera.
Yeah, and there's a specific example of a medication that you don't want to overdose because it does have liver and kidney toxicity, and you don't want to underdose because if you're not giving enough, you're not fighting the fungus.
Mm-hmm.
Right.
Even though we do a lot of supplements and immune boosters with it to really speed up the process, we don't like to take business away from Justin, but we like to get them off the medicine as fast as we can.
If we the less fluconazole we can dispense, it's better. And that's we talked last time about the research going on at U of A for valley fever and everything like that, and that's a good thing. The more animals that we can move off the fluconazole, the better.
Yep.
So what's the actual difference if you're compounding it versus purchasing this much more expensive one? Is there any difference at a level of atoms?
No,
anything?
It's the same. It's the same exact fluconazole. I probably venture to say that the drug companies are buying the fluconazole powder from the same place that we're buying. The same companies are developing it. We just buy it in its raw form, and then we make it into capsules with usually a plant fiber filler and to the right dose, et cetera. We also do it in treats, animal treats that are flavored like chicken or beef. If that sometimes animals just have a problem with the capsules, so we do that as well, and then we do the liquids, like if that's an option too.
Yeah, many of our animals, in fact, Justin's even great enough so like even on some of our supplements, we have one herb that we use called bloodroot or neoplasine that's very bitter. It's a plant alkaloid, and he's even great enough to take that and put flavoring in that for us for our clients when they have to give it for cancer, and it really makes a world of difference to our animals.